We got the horns blowing, the dogs howling. It's a good morning here. Welcome to the beautiful, the chaotic, the city of temples, Kathmandu, here in Nepal. I want to talk to you a little bit about something called Scrub Typhus.
I'm Scylla, and this is Lorenzo. We are doctors looking for a way to combine our passion for medicine with our love for exploration. We picked up our lives and sold all our stuff to start a new adventure.
Hit the like and subscribe, and let's go. Welcome to the city of temples, the beautiful, the chaotic Kathmandu. Here in Nepal, I was visiting my good friend and fellow physician, Dr. Nishant, at his clinic, and we were talking about just how many infectious diseases that they've come to become familiar with and easily recognize in their patients, from dengue to tuberculosis to something called scrub typhus. Scrub typhus, that's something I never heard of before. I went home, I looked it up, and frankly, I am terrified. So scrub typhus is transmitted by a mite, what we know in North America as the chigger. It's also known as a berry bug or harvest mite. They live in forests and vegetation, wetlands, and they feed on the skin cells of animals like mice, rabbit, and sometimes even accidentally humans. Scrub typhus is caused by the organism Orientia Tsutsugamushi, not sushi, a rickettsial organism that is in the same family as our friend causing Rocky Mountain spotted fever, which is more endemic to the North American continent. So what happens when you get scrub typhus? Well, it's a vasculitic disease, which means that it causes inflammation of the blood vessels throughout the body, and it can sometimes be fatal. That's why it's so terrifying. Research shows that it is endemic in an area known as Asia-Pacific Triangle, in the West Pakistan, South Australia, and Japan in the East. The challenging thing about this disease is that it has pretty non-specific symptoms, especially initially. It can present with fevers, headache, myalgias, gastrointestinal symptoms like abdominal pain, nausea, vomiting. Things to keep on the differential here: malaria, dengue. It can take about 6 to 12 days for the incubation period after you get bit by the chigger or mite. The physical exam is often not very informative. If you do find an eschar, that's great. In the setting of generalized flu-like illness, an eschar is, some might call it pathognomonic for scrub typhus, and if it was me, I would just initiate empiric treatment. However, this might not always be found, and because it's just generalized flu-like symptoms, having a high degree of suspicion is important. The lesion at the mite mark starts with a papule that turns into a locally centrally necrotic lesion with a black crust, and this eschar takes quite a while to heal. And so if you do a careful skin exam in patients having the symptoms that I mentioned, you might just find it. Definitive testing of scrub typhus is via serology, so antibody testing. However, a lot of times the definitive testing is not something that you can wait for, especially if the patient is very sick, because there are no rapid, easily available, and sensitive diagnostic tests for scrub typhus. Maintaining a high level of suspicion in empiric areas is very important to the diagnosis, and empiric treatment should be initiated because of the risk of such severe end organ dysfunction. Some of the end organ dysfunction that you might see in severe cases of scrub typhus are mainly affecting the cardiac, pulmonary, and neurological systems. In the lungs, you can develop pneumonitis, ARDS picture. You can also develop AKI and a renal injury bordering onto renal failure, which is probably related to the congestive heart failure. And on top of that, encephalomyelitis, meningitis, altered mental status. It's not a good situation. Luckily for us, and unluckily for the rickettsial infections, Doxycycline should be able to take care of this. This antibiotic can be given as 100 milligrams IV or PO for 7 to 14 days. There are some reports of antibiotic resistance though, and so potential alternatives include azithromycin and tetracycline. The bottom line is, for scrub typhus, this can be a fatal disease. It is probably more common than we think in causing fevers and general nonspecific symptoms. So in summary, scrub typhus caused by Orientia Tsutsugamushi or rickettsial bacteria is transmitted by the chigger found in vegetations, wetlands, grasses. If you develop flu-like symptoms, generalized malaise, fevers, and see an eschar, think about going to the doctor. They should have a high degree of suspicion, especially in an endemic area such as this. Treatment includes doxycycline. It's a terrifying disease if you let it progress to systemic manifestations. However, it is very treatable. And now that we know a little bit more, hopefully we're not as scared. So I hope you enjoyed this video. Like and subscribe, and namaste.